everyone. Happy evening, a very good evening. I hope and I believe all of you are doing well. And welcome to today's YouTube live session, which is episode 33 in NF100. What is NF100? FMGE Top 100 topics. Okay, so Nikita's FMGE Top 100 topics, which are must watch for your exam, especially the FMG students here. You have your exam on 12th of December. Please watch all these sessions. They are highly important. Apart from that, for the FMG students, I've also started a FMG crash course, short 150, where we are going to discuss important topics from all the subjects. And I am expecting a lot of questions from these topics in the exam. So this series is going to be every day at 10 a.m. We have started today. It's going to go on till 10th of December. Today in the part 1 of the series, we discussed important topics in pharmacology. Tomorrow, part 2, we are going to discuss, quickly run through biochemistry, the most important topics. Okay, the most important topics. So please make sure that you do not miss on these sessions. NEET PG students, remember that these sessions are also important for all of you. This is not only for FMG. As I always say, FMG, whatever you read is the core. And then you have these extra things that you need to read for NEET PG and INICT, right? So I'm hoping to see you all on the app. These sessions are going to be on the app. Is asked for the unlock code. Use the code Dr Nikita Live to unlock these sessions. Okay. Now let's also talk about the Mnemonics Marathon, which is going to be there tomorrow, 2 p.m. 7 p.m. and then you have at 9 p.m. the mnemonics test. Whatever you learn in these sessions, I'll be taking a session at 5 p.m. radiology. Okay, so we'll learn some important volatile topics in radiology, like the contrast media, the important appearances of the heart with mnemonics. Where do you see boot-shaped heart, the egg on side and all of that. We are going to see some important nuclear medicine scans. We are going to learn the half-life of the various radioisotopes. All these are most important, at the same time very volatile for your exam. So we are going to see all of this tomorrow in the 5 p.m. class. So we have a class tomorrow 10 a.m. and 5 p.m. The free live classes on the app. Right. Apart from that, the NEET PG and the next 2023 students here. Let me also tell you about the free tests that we have, which go on the platform. So you have Wednesday, Friday, Saturday, Sunday test. All these tests are the free tests. You can take these tests, and we have dedicated tests for the plus batches which are going on. Okay, so please make a note of this. And these are the new batches starting on 8th of December, integrated system-wise batch. And then we have for NEET PG 2022, there's test and discussion. So you will have module 1, the test and discussion format, where it's going to be around 180 hours. This is starting on 8th of December. And we have ultra fast revision, which is approximately 150 hours. So entire revision for NEET PG is going to be done starting 8th of December. All right. Now let's start with the first one here. Very important. How do we identify these eggs? I'll tell you all the tricks to remember the various eggs. I hope the sound is clear, everyone. Okay. So in the schistosoma eggs, this is very frequently asked. How do you identify schistosoma? Hematobium, Manzoni and Japonicum. So remember that in the spine, one has lateral spine like we see here. One egg has lateral spine, one has terminal spine, and one does not have a spine, it has a knob. So in the spine, the one which has terminal spine, okay, terminal spine, remember T for hematobium. Okay, so hematobium. You see that T comes only in hematobium, not in Manzoni, not in Japonicum. So hematobium has a terminal spine. Remaining one, that is Manzoni and Japonicum. I'll write the Japonicum as Japonicum. So you can see Manzoni has S, so it is spine. Japonicum has K, so it has knob. Both of these are lateral spine and lateral knob. Terminal goes with hematobium. Okay. So look at this one. This is the terminal at one end. So this is hematobium. This is lateral spine pointed. This is spine. So this is Manzoni. Japonicum has a lateral knob. Okay, so this is how you identify the schistosoma eggs. Very important. Now tell me, what egg is this? Which schistosoma egg is this? Hematobium, Manzoni, or Japonicum? Dr. Gurdeep, PDF. I'm so sorry I forgot to share the PDF before the class. I'll do it after the class. Okay, I'll do it after the class. Very good. So this is Schistosoma manzoni. Why do you call it Manzoni? Because it has a spine and the spine is not terminal. So this is not hematobium, lateral spine. This is Manzoni. Okay. Tell me, what do you think are these eggs? First, बताओ कौन सा parasite है ये? Is it Enkylostoma? Is it Ascaris? Is it Tinea? Is it H. nana? What is this? Okay, so I see majority of you saying Ascaris. I have confusion between Enkylostoma. Few students saying Enkylostoma and also H. nana. Okay, so let me tell you the easy trick to remember this. Remember Ascaris. Okay, these are Ascaris eggs. To remember Ascaris, remember has a scary egg. Okay, this is a scary. Ascaris is a scary egg. Why is it scary? Why is it scary? Because look at the surface. The surface is not a smooth surface. It is tuberculated, like the lumpy, bumpy appearance that is called as tuberculated appearance, right? The surface has tuberculated appearance. Remember, Ascaris is not a smooth egg. It is tuberculated. It's a scary egg. Now, out of this, which one is fertilized and which one is not fertilized? Seem like Staffy love this mnemonic. Okay. So, which one is fertilized and which one is non-fertilized? So keep pouring those emojis and the fire thing so that I know that you are loving the mnemonics. And yeah, that motivates me for sure. So, this one and this one, the one which you see here, we know that a fertilized female, okay, how's a fertilized female, a pregnant female? She's a moti female, okay, she's a moti female. So, the mota wala egg hai, mota wala is the fertilized. This one which is long and slim, okay, so a unmarried female, that she is long and slim. So, the slimmer one is the unfertilized and the mota one is the fertilized egg. Okay, that is the fertilized egg. Now, out of this, which egg floats? Saturated salt solution, which egg floats? Unfertilized or fertilized? Which one floats? Remember, fertilized, F for F. It is the fertilized egg which floats. Okay, I'll tell you the mnemonic towards the end, which are all the eggs that float. Okay, so fertilized egg floats. So this is how you'll identify Ascaris. Going to the next one, very, very important. What do you think? Which egg is this? Which egg is this? See, now you have eggs which have something at both the ends. There is something like bipolar. Okay, bipolar. There are eggs, one egg which has bipolar mucus plugs. There is an egg which has bipolar mucus plug. And there is an egg which has bipolar filaments. Which is that? Where you have bipolar things, okay, जो भी egg में bipolar mucus plug है या bipolar filaments है, these are the names which are repeated twice, like trichuris, trichura, same word, almost the same word repeated, trichuris, trichura. Then you have H, na is repeated. So remember, the ones which are repeated have bipolar things. Mucus plugs is trichuris trichura. Okay, mucus plugs is trichuris trichura. Bipolar filaments is H. nana. So the words which are repeated, they have something at the bipolar thing. Okay, so this is bipolar mucus plugs. This is very, very important and a frequently asked question. You can get an image-based question on this. So this is trichuris trichura, barrel-shaped egg, bile-stained, and it is with bipolar mucus plugs. This is what I was talking about. H nana, word repeated, bipolar things. If you see carefully, there would be these bipolar filaments. Okay, there would be these bipolar filaments. ये है H nana. जो H nana है, it's a cystoid egg. And remember the characteristic of cystoid egg, it is hexacanth. Okay, you will see this 3 pairs of hooklets. Okay, you will see the 3 pairs of hooklets. That is 6. That makes it hexacanth. So H nana versus H diminuta. How do we differentiate? Remember, in diminuta, the polar filaments are diminished. Diminished means absent. So there are no polar filaments. So here you will see that the polar filaments are not there. H nana, repeated, it has bipolar filaments. Okay, hexacanth is going to be a cystode. Look at this egg. We have already seen a scary egg is unfertilized, long and slim. Motawala is fertilized egg. Fertilized is the one which floats. Okay, tell me, what do you think is this egg here? Which egg is this? What do you think? Which egg is this? Very good. This is Enkylostoma. Okay, this is Enkylostoma or a hookworm. The trick to remember this is hookworm. Hook जो होता है room में हम hook use करते हैं to clear the space in the room. Okay, so like we have stayed in hostel, to clear the mess in the hostel, in that one room everything is stuffed up. To organize the things we use the multiple hooks. Remember, clear space. To clear the space in the room, we use hook. So hookworm is the egg which has this clear space. Can you see this clear space here? So this is the clear space that you see. So clear space is hookworm. Another thing, how is the egg here? The embryo that is segmented. Okay, it is a segmented egg. So to remember this, when you write hookworm, remember there is double O. So basically one egg has been divided into 2, that is segmented, that gives double O. So hookworm is the one which is segmented egg with clear space, that is hookworm and Enkylostoma. Okay. So this is again hookworm, a better image here. This is the clear space and this is the segmented egg, right? The segmented egg. So this is the egg of hookworm, that is Enkylostoma. Okay, that is Enkylostoma. Look at this one. This we have already seen. Tell me, what egg is this? So a spaced repetition basically, and very, very short spaced repetition. What is this egg here? Very good. Here we see the lateral spine. Lateral spine we have already seen in the beginning. That is Schistosoma mansoni. Okay, that is mansoni, not Hematobium. Look at this egg. What do you think is this egg here? What do you think is, which egg is this? Very good, Staffy. This is very good, Aruna. This is Enterobius. Okay, this egg which we see here, this is Enterobius vermicularis. Now, how do we remember Enterobius? Remember, Enterobius is like Exterobius. Okay, it is Exterobius. To remember this Exterobius, remember it is like plano-convex. Okay, so which egg is plano-convex? You can see this, it has a plane surface and it has a convex surface. So basically a plane surface with a convex surface, and there is that larva within. So that is plano-convex. EX is Exterobius, that is Enterobius. So this is Enterobius vermicularis. Bile stained or non-bile stained? Bile stained or non-bile stained? You can see it is white, not yellow color. It is non-bile stained, right? Non-bile stained eggs, we will see Neha, right? That is Neha. So उसमें जो E है वो है Enterobius. उसके बाद let us see the next one. टीनिया के एग्स हम कैसे आइडेंटिफाई करेंगे? टीनिया सोलियम और सैजिनेटा डिफरेंशिएट, वी कैन नॉट डिफरेंशिएट. टीनिया will have same सोलियम और सैजिनेटा. The trick to remember first, टीनिया, is it a cystode? Is it a trematode? Is it a nematode? What is it? You can see the hexacanth here, the hooklets, hexacanth, cystode में. And Taenia is linear. Okay, remember Taenia is rhyming with linear. So there is linear striations. Okay, there is linear striations. What are the linear striations? You will see like this. Okay, the radial striations, basically the striations like this. Look at the egg here. You have the hexacanth, okay, the 6 hook slit, and you have the radial striations. Remember, Taenia is linear, that is Taenia ka egg, solium and saginata look the same. So linear striations is Taenia, okay. After that, look at this one. What do you think is this egg here? I think the image is too small here. Let me see if I can zoom this image for you. Okay. What do we see here? We see something like a hooklets here. So this is a cystoid egg. And these are, if you see very carefully, there are the linear striations. There are these linear striations. So this egg again is tinea. Okay, this is tinea basically. Tinea solium saginata. Okay. Look at this one. We have already seen this image. What eggs are these? What eggs are these? The eggs look scary. Very good. So the scary, the tuberculated surface scary egg is Ascaris. Okay, this is Ascaris. That is what we are seeing here. Look at this egg. Okay, what egg is this? Of course, we have seen this also. What is this? Very good. We have the terminal spine here. So terminal spine is hematobium. This is schistosoma hematobium. Okay, this is schistosoma hematobium. This egg, what do you think is this egg here? We can see the hexagon that tells you that this is a cystoid and look very carefully. Bipolar यहाँ पे knob जैसा है और वहां से filaments आ रहे हैं. Yes, so that is H nana. Nana, bipolar thing. There is bipolar filaments. This is H nana. Okay, H nana. Identify this egg. What do you think is this egg here? A, B, C, D. Ascaris, Enkylostoma, Enterobius, Trichuris. Very good. The clear space here, that is the hook, right? The clear space. And we have the segmented egg. Okay, the segmented egg. So this is Enkylostoma. That is basically hookworm. Okay, that is basically hookworm. Next one. This is a question asked in one of the AIMS exam. What is the drug of choice in this condition? So remember, it's not only identification of eggs, you should also know the drug of choice. What is the drug of choice in this case? This is schistosoma mansoni. The lateral spine tells you this is mansoni. For schistosoma, it is praziquantel. Okay, it is praziquantel, which is the drug of choice for schistosoma. Okay, that is praziquantel. Next one. Tell me which of the following eggs, A, B or C, which of the following eggs is non-bile stained? Which of the following eggs is non-bile stained, A, B or C? Okay, so I'm waiting for the correct answer. If anyone gets a correct answer here, I think none of the students has got correct answer. Yes. The answer is all of the above. Okay, all of the above are non-bile stained eggs, right? They are non-bile stained. What is the mnemonic for non-bile stained? What is the mnemonic for non-bile stained? It is Neha, right? Neha is non-bile stained. Nicator, Nicator, you have Enterobius, Echnana, and Enkylostoma, right? And Enkylostoma. So what egg is this here? You see the clear space, the segmented ovum there. This is hookworm, that is Enkylostoma. This is what egg? Plano-convex. This is Enterobius. Plano-convex, exterobius is Enterobius. This egg here is H. nana, the bipolar filaments. So all of this H. nana, Enterobius, and Enkylostoma, all of these are non-bile stained. Okay, all of these are non-bile stained. Remember the mnemonic Neha. Okay, remember the mnemonic Neha. Next mnemonic, the last mnemonic here, eggs which float. Which are the eggs which float? The mnemonic to remember that is eggs which float is, remember the mnemonic is feather light. The eggs which are feather light as feather, so they float because they are feather light. So remember FEATH, feather ka. Fertilized Ascaris, remember it is not unfertilized. Enterobius, Enkylostoma, Trichuris trichura and H. nana. So feather light जो eggs हैं, right? The feather light fertilized egg of Ascaris, Enterobius, Enkylostoma, Trichuris and H. nana. So the ones which are non-bile stained, that is जो नेहा में हमारा आ रहा था EHA यहाँ पे भी आता है, right? They are non-bile stained as well. This one as this one. Remember feather light, FEATH. These are the eggs which float. Okay, these are the eggs which float. Give me a minute. Let me just check. So this is the slide that we missed. Okay, identify these eggs here. Now, what do we see in this egg is there is operculum. Okay, there is operculum which is present here. There is also an operculum. Operculum means a lid. So operculated. Okay, these are the operculated eggs. Which eggs are operculated eggs? Which eggs, generally which group has operculated eggs? Cystoids, trematodes or nematodes? Which one has operculated eggs? So remember, all trematodes are the ones which have operculated eggs, except which trematode? Schistosoma. We saw schistosoma ka eggs that do not have operculation, right? उसमें operculum नहीं होता है. Which is the only cystoid egg which is operculated? Only cystoid egg which is operculated? Diphyllobothrum latum. Okay, it is Diphyllobothrum latum. Remember, it tends to be both a cystoid and a trematode. Cystoid है, but trematode जैसा feature है, that is operculum. That is Diphyllobothrum. Schistosoma, what do we mean by schisto? Like schizophrenia. This is basically SCHI, SCHI. Split personality, right? Split, that is cut. So remember that in schistosoma, what is cut? Remember that the operculum is cut. Okay, the operculum is cut. So which trematode does not have an operculum? Operculum cut, schistosoma. Which cystoid has an operculum? Acting like a trematode, cystoid and trematode, that is Diphyllobothrum latum. Okay. So here, this one, how do you differentiate? This is the egg of Diphyllobothrum latum. This is the egg of Clonorchis sinensis. The difference is both of them have operculum and a knob at the other end. Clonorchis sinensis, remember S for shoulder. It has this shoulder-like projections at the operculum base. Okay, so that is shoulder is present in sinensis. There is no shoulder present with Diphyllobothrum latum. Okay, and the other egg which is operculated, that is Spirometra. Okay, that is Spirometra. Remember operculated eggs, STD, Spirometra, trematodes except schistosoma, and Diphyllobothrum. Okay, and Diphyllobothrum. So you can remember this as to prevent the STD, that is a sexually transmitted disease, we should use an operculum, that is the lead. Lead, that is basically a contraceptive device like condom. Okay, so operculation should be used to prevent STD. क्योंकि बहुत बार ये होगा कि याद ही नहीं आएगा कि ये काय का निमोनिक था. So remember that STD prevent करने के लिए operculum use करना चाहिए. So operculated egg is STD. That is Spirometra, trematodes except schistosoma, and Diphyllobothrum. Sinensis, Clonorchis sinensis, trematode has operculum with shoulders. Okay, it has operculum with shoulders. Right? So, yes, that was about the mnemonics for parasitology eggs. Okay, that was about the mnemonics. I think it's quite an easy one. A topic which has been asked in NICT also recently, match the parasite with the eggs. You'll get the PDF on the Telegram group, which is Dr. Nikita's Rad Synapse. Okay, you'll get the PDF on the group, Dr. Nikita's Rad Synapse. I'll share the PDF with the annotations. I have saved the annotations. I'll share it on the Telegram group. And also all the students NEET PG 2022 following the daily targets, right? The timetable that I've given you, so that to keep you on track. Pharmacology targets I'll be sharing with you on the group also now, and we will have the classes at 5 p.m. in accordance with our daily targets. Those are the free live classes, except tomorrow we have radiology tomorrow. We'll start with pharmacology day after. Okay, so radiology will be there tomorrow. All right. So malaria, Mukund, I've already taken in NF100. I've taken the mosquito part also and the plasmodium part also. So watch the NF100 episodes. That is what I said. Please watch the NF100 episodes. Bacteriology, gram positive, gram negative. The important points I've covered in the plus course on mnemonics. You can watch those. Okay, the plus students can watch those. All right. Okay, thank you so much everyone for joining in. I hope this helps you remember all the eggs, and I'm sure you will not forget once you revise the mnemonics. Have this mnemonics handy for revision so that it helps you during the last time before the exam. Thank you so much. Goodbye. Take care. Keep studying, keep revising, and keep winning. And remember, I'll see you tomorrow at 10 a.m. with biochemistry mnemonics. Okay, the last minute tips and tricks in biochemistry. That is what we learn tomorrow. Okay, good night, everyone. Take care.